Welcome, everyone, to today's webinar. My name is Brianna Gonsalves, and I'm happy to be moderating today's webinar on behalf of the Community Technical Assistance Center of New York. Today, we are joined by Andres Hoyos for a presentation titled Introduction to Transgender 101, Basic Concepts to Work with Transgender Population. This webinar was previously recorded. However, do not let that discourage you today from submitting your questions. You can email your questions to ctac@ctac.info@nyu.edu or to Andres directly at the email provided at the end of today's presentation. This webinar was also recorded in Spanish, so if you are interested in the Spanish version of today's webinar, please visit our website, ctacny.org, to access the presentation slides and the recording. So today's presentation will draw on Andres' experiences working with the transgender population. In a society that does not provide this community with safe spaces to access education, employment, health, housing, and other basic human rights, it's not surprising then to find that the transgender population has much higher prevalence than the general population regarding low level of schooling, precarious housing conditions, sexually transmitted diseases such as HIV and hepatitis C, mental illness, substance abuse, suicide, unemployment and underemployment, poverty, among other problems. As providers of social services from a perspective of social justice, it's imperative that we make a critical analysis, think about how this came to be, and understand our role as providers in understanding how to be part of the change that needs to happen. So without further ado, I will now pass it over to Andres to introduce himself and to get us started.
Thank you, Brianna, and hello to everyone. I'm very happy to be here with you today. I am assuming if you are listening to these webinars because you have interest in learning about this community, and that is a great place to be. I think more providers should be competent in working with transgender community. So let's start a little bit with who I am and a little bit of my experience, the training and professional experience that informs some of the knowledge that I will be sharing with you today. So my training was in clinical psychology and social work. I'm a professor at NYU in New York City and also in Argentina in Buenos Aires. I have taught also at Columbia University School of Social Work. I have been doing this work for over 2 decades with a lot of emphasis in social justice. Worked over 10 years at the LGBT Community Center in New York City. And some of the areas of expertise that I have are working with substance abuse treatment, HIV and AIDS, immigration, working with asylees and refugees, where I work a lot with transgender community, work around trauma, and in the later years, I've been working with indigenous women and their children doing community organizing in Latin America. I hold a private practice. I have a private practice in New York City as well. So let's move into content for today's presentation. So what are the main objectives of this lecture, this webinar? The first one is to become familiarized with components of a different way of thinking, also with the ones that got us to where we are today regarding transgender community, and and to have a critical analysis of those, the history, socio-political, climate, etc., that got us to be here, and what would it mean to change that for the better, both as providers, for our clients, but also for society at large. On the later part of the presentation, I'll be talking about how to expand knowledge and best practices with this community, so more concrete examples as to how we can take action individually as a provider, at our agencies, and as community members, okay? So this is the content for the presentation today. We're going to start with some introduction that would be about terminology. Then we're going to see some information as to why this knowledge so important? Why is it imperative that we are aware of what's happening and how to be part of the change we want to see happening and that is needed? We're going to talk a little bit about historical, sociopolitical, and cultural context. It's very important to have those in consideration, given the first objective that I already talked about. We're going to talk about a framework that will help us understand better the work with these communities, some guidelines as to how to work with the communities and considerations in our relationship one-on-one or with communities that identify as transgender. And then, as Brianna said, we will have time for Q&A. And even though it's pre-recorded, you can access me via email, and you can access CTAC also via email. And we will be happy to answer your questions. So the first part is the term transgender. And here we're talking about an umbrella term, meaning it's one word that includes many different words. So we're seeing there in the graphic trans, cisgender, trans woman, gender dysphoria, F to M or M to F, which is another way of referring to transgender people, more old-fashioned. So what is important is these identities of what it means to be transgender or belonging to a transgender community is a construct that is very individualized. Therefore, we shouldn't make assumptions as to what it means to us would be that it would be the same that is what it means to the other one that we have in front of us, being that a person or a community or a group of transgender people. But we need to understand, and one way of doing that is asking them what it means to them. How do they understand that terminology? So some basic concepts to clarify. First is the concept of sex. And this refers to biological components, the biology of an individual. That includes hormones, chromosomes, genitalia, other body parts, other organs in our bodies. Some are obvious, some are internal organs, so we might not see them. And it's a very complex concept that usually we have understood it in a binary way. So we understand that the sex of a person might be male, female. Usually that is marked or assigned or determined by the medical provider at birth or perhaps early during the pregnancy. However, usually is driven by what the doctors see as genitalia in the baby that is born or in the womb. We know as science has evolved that this concept is way more complex. So even though there might be a very clear genitalia that might indicate that someone could be identified as male or female, we know that their chromosomes or the hormones or other things in their biological structure might not be matching exactly that. So now we are aware of the importance of having a more comprehensive understanding of this concept of sex. Now, gender identity is how the individual identifies, and sometimes that match what that medical provider stated at birth for this person, and sometimes doesn't match. When it matches, let's say I was born and the doctor determined that I was male and I identify later on in life as a male, therefore I would be a cisgender person, which is the third word that we see there in the list, which means those of us who identify with the gender that was assigned to us at birth or that we were labeled with. Now, if someone doesn't match that identity, is what we call transgender. So someone might have been assigned at birth female, but identify as male, or vice versa. Someone is identified as female at birth, and the person themselves identify as male. Gender expression then is how the individual person decides to express this identity, this gender identity. So not everybody who is identifying as female will express their femininity in the same way. Sometimes it might be very in tune with what the culture and society might expect. Sometimes it can be somewhere in between both genders, sometimes can be perhaps very different from the gender identity that the person has. So this is how we act, how we dress up, manners, how we interact with other people, how do we intervene on our body, either through permanent interventions like surgery or through temporal interventions like how we cut our hair, what do we do with our nails, makeup or not, well, way of dressing, etc. Now, gender role talks about the role that this person, based on their gender that they were assigned or their gender identity, is expected to have in society. So we have a society that is constructed in a very binary gender roles. We have males and females, and we know that we assign or assume that there is a color, so males blue, females pink, boys play with cars and trucks and construction blocks, girls will play with dolls and other like household or things associated with the role of mothering and being in house. Not necessarily these will fit the person's identity, and it can vary greatly. So we have the gender identity, how that identity is expressed, and then how that is understood by society. It also, gender role will also manifest itself in roles that society will allow one or will prefer one or another gender to have. So what are the type of jobs, employment, salaries, etc. The next concept, even though it's a different concept, is usually misunderstood when talking about transgender communities, so I'm going to clarify that here, which is sexual orientation. Sexual orientation is this attraction that we have towards the other person, and that is defined by the gender, my gender, and the person that I feel attracted towards. So there are two gender identities at play there for sexual orientation. So sexual orientation, let's say a woman feels attracted towards other women, therefore that person, regardless of being transgender or not, would be identified as lesbian regarding sexual orientation. A transgender man or cisgender man who feels attracted towards men will be defined as gay, and someone who is attracted to the opposite gender would be considered heterosexual. If the attraction is towards both genders, male and female, would be considered bisexual. This is a very simplistic summary of these concepts. There is definitely more shades of gray in between these binary concepts that we are referring here, and it would be good to be familiarized with those, but that's not the main topic for today. The last one in this list is, the last term is transphobia, and transphobia is not actually a phobia as psychology will define it, but it makes reference to all these negative preconceived notions that society has at every level. So we see it in families, we see it in groups, in communities, we see it in public policies, in institutions of all kinds, because historically this community has been understood with a negative connotation. Therefore, all the institutions that have been built and everybody who has been part of this society would be impacted by that negative notion. So it would be important to recognize that we all have some level of transphobia because we have been exposed to these negative preconceptions, and it is important for all of us to be aware of that. One last term here to talk about is the term queer, which is also an umbrella term and can be used for gender identity or sexual orientation or both of them. We have another training here on CTAC, both in Spanish and English, about cultural competence, working with queer community. And if you feel that you would like more clarity as to what this means and what it would look like working with this community, more than welcome to look into those resources. So why is it imperative to do this work that we're doing here today, to learn these? Numerous studies have shown that around injuries and violence, up to 60% of people have experienced physical aggression or abuse, and 2 out of 3 people who identify as transsexual have been victims of sexual assault. Keep in mind that these numbers might be lower than what actually is happening, because when a community has been oppressed and doesn't find systems that would be supportive, they might not report these kind of incidents. They might not access services as much as the regular community, the general community. So we might be thinking of even greater prevalence. Around suicide, we have people ideation, transgender people will have an ideation up to 65%. So 6 to 7 people out of 10 might have thought of that. And attempts would be 3 people out of 10 transgender people will have committed suicide, or have attempted to commit suicide. Around mental health, there is a prevalence definitely around depression, anxiety, and other clinical conditions that are greater than in the general population. All this information is from the Substance Abuse and Mental Health Services Administration. They produced this report on health issues on LGBT people in 2012, and that's where we got all these. So some other important information is methamphetamine use or substance abuse. About 46%, almost half, almost 1 out of 2 people who are transgender have been exposed to methamphetamine, have used it. And injecting drug use, 40%, which is 4 out of 10. This creates higher risk for not only substance abuse, but also for all other kind of health issues like hepatitis C and HIV, etc. Tobacco use has greater rates among transgender community, being in some research identified as up to 74%. So 3 out of 4 transgender people might use tobacco. That's way higher than general population. And another important thing is that many people who are transgender might not access treatment services because they will find discrimination, hostility, insensitivity from the providers, from the agencies at large, from their peers at their facilities during the group sessions, etc. They find services that are very structured in this binary way, that is only for males and females, cisgender, so a transgender person might not be welcome or feeling as safe or as included as other community would feel. And that has a huge impact in their ability to access services. And I would mark that it's not only around substance abuse. This happens with general health services at the emergency room. It happens in the school system. It happens with the transportation system, housing. Definitely they experience discrimination. So this is a community that not only has higher prevalence of many issues that are problematic or concerning, but also more difficult time accessing the resources that are there for the community at large. Around HIV and AIDS, there is higher prevalence among transgender women also, almost 68%, so almost 7 people out of 10. Is higher among women of color and transgender youth, putting them at higher risk for HIV infection. Sexually transmitted disease, there is a prevalence of syphilis up to 79%, almost 8 people out of 10 would have been exposed to syphilis. So all these things are pretty problematic, and I want to say, before we move along, that it's not that the community was born or has any precondition to any of these. This is just symptomatology that they have developed due to systemic oppression that they have been experiencing from early on in life in every context that they have been part of. So as I said, at school, in their own families, in the neighborhoods, at church, at the hospital or healthcare system, etc. So now let's talk a little bit about historical and socio-political context. this is always framed in an ever-changing cultural context, and this is determined by by many factors, by religion, place of origin. So talking in concrete examples, New York has more than its third of the population foreign-born, and it might be very different to be a transgender person who is an immigrant from a different country versus someone who was born in New York City. Even migrants, someone from the Midwest or from the West Coast might have a very different experience from rural areas versus being in a metropolitan area. So taking in consideration what is this cultural context that the person experiences is very important. We come from a culture that is very centric, meaning a lot of the knowledge is produced in the Western world. We also make the assumptions that we know or is familiar to us is what is normal and what is expected and what is moral. So that's what we call ethnocentric culture. And it's important to keep an eye on that and be more open to differences without making negative judgments. We live in a capitalist system. It's an economic system that marks that the exchange of produce by consumption, markets, selling and buying is very important, and that has an impact in this community. Because then, unlike other economic systems, it might be very important how the person presents themselves, meaning what they have access to, and also how they intervene on their bodies through surgeries or otherwise. This is a sexist society as well. We are aware that there is still definitely differences based on gender. This is a patriarchal society that gives advantage and privilege unearned to male, people who identify as male, and this is also the case for transgender male. One of the things that happen with this community is that transgender men will be invisibilized in society. They are not seen. It's like erased. And then transgender women face a lot of the stressors that daily interactions may have, from finding employment. Therefore, sex work could be one of the few or limited source of income that they may have. Historically has been the case. We live in a society also that is racist and classist and has all these isms that we have in our society, and it's important to keep this in mind because then we're going to talk a little bit later about intersectionality. So it's not the same of being transgender and period for everybody. It's different if you're a male transgender or female transgender. It's different also if you are a person of color, and within people of color there are also hierarchies. So it's different if you're Latino versus if you are African American or if you're an Asian transgender person. We'll talk a little bit more on that later as to how to take care of that in the interaction with the clients. Another important concept is the role that the state plays in this population. The state regulates what resources are available and how those are distributed, who has access to resources in society, who is entitled, who is deserving, who is not entitled or undeserving. So in a way, they regulate many things, including our access to health, access to treatments, hormone replacement therapy, and define in many ways our own identities or ways in which we can validate or express these identities. So in the States, we know that it has been changed, but still there is a lot of barriers for people accessing, people who identify as transgender, accessing resources early in childhood or pre-puberty, teenage years. This is very important because it's during these years that many hormonal changes are happening, and with those physical changes, some of those are irreversible, some of those can be changed, but it would be more difficult to revert them and definitely expensive and will cause distress, physical, emotional, etc. So early access to these protocols is regulated, these services is regulated by protocols that are put in place by the state, by the government. It could be different in different states, it could be one on a federal level, but it's important for us to be aware of those. And there are other countries that have been more progressive around this. One of those, for example, is Argentina, that has one of the most progressive transgender legislation or gender identity legislation in the world, when people are not asked to be labeled or access medical services and to be diagnosed with something that is pathological in order to be able to have their insurance to cover for their hormonal treatment needs or surgeries, etc. So let's look into also what is being done outside of our own country and what can we learn from them. Socialization is very important for any human being in any culture, and in our society, socialization is based on gender. It's not a coincidence that the first thing we ask when we see someone who is pregnant is asking, is a boy or is a girl? And based on that, this complete dichotomic way of acting, behaving, even thinking what is the color that I'm going to be giving of this specific present, etc. So we have to be mindful of that and also question what is the value of that. Why don't we ask, is the baby healthy? Or other perhaps more meaningful questions than just enforcing these binary as to gender-based, and with that creating separations in our community that might not be that helpful for the person or for the community. The last point I want to talk here is religion and spirituality. As we talked, transphobia is something that permeates every institution in society, including religious institutions. So it's not a surprise to find religious groups that might have a very negative understanding of the transgender community. And that's problematic. There are few, there are more modern ones that are very accepting, but in general, there is negative preconceived notions about the community. Belonging to a religious group, it can be very important for some transgender people. Therefore, I think it's very important to understand that there should be a space to assess and honor spirituality, meaning religion is the institution, spirituality is the personal experience. So helping clients connect with religious institutions that are more trans-affirmative, better understanding of transgender community, and helping the individual also to understand their own religious belief and tailor it to their own identity, needs, strengths, etc. And we have our graphic here just to show all the diversity of symbolisms that have been created around this gender identity. So it's not just 1, 2, or 3 with one in the middle. There are plenty, just as a graphic illustration of what we are talking. So what is the framework that we should have if we want to work with the transgender community? One is definitely a strength-based perspective, which is because it was considered psychopathology and it was diagnosed. Therefore, the general community and the medical community and the scientific community might see this as something that is problematic, is deficit-based, and that is an outcome of negative experiences in life, trauma, or otherwise. Well, if we're going to be providers for this community, we need to be part of that shift in paradigms and think differently and see the transgender individual as someone who has a lot of strengths, and they develop that identity for good reasons, not only for challenges or traumatic experiences that they might have faced, and that it's okay to have that identity. We should have emphasis in working with communities. Isolation is one of the biggest problems with communities that have experienced historical oppression, like this one. So helping people connect with each other is very important. There are different ways in which they can connect. One is definitely face-to-face, which is very powerful because it's how we are designed as human beings, to look at each other's eyes and create empathy. So if we can create that in our area of work, in our region, that would be fantastic. Another way of creating communities, we know now that technology has allowed us to bring people together even if they are in very different locations geographically. So we have chats, we have video calls, people in rural communities can find sense of belonging to a greater community outside of their local geographic location. So we should then definitely consider ourselves as waivers of social networks, both for the clients and their community as for the providers, connect with others, and I'm going to talk a little bit later on that as well. We should be thinking on social justice as main pillar or core part of the work that we do, because we're talking about intersectionalities of oppression, and therefore we should be allocating resources to those who are more vulnerable. We talked about youth, we talked about transgender women, we talked about immigrants, we talked about people of color. So of course, if someone is a transgender woman who is a young adult, undocumented, who happens to be Afro-Caribbean or Afro-Latina, who also practices Santeria, or a religion that is not the mainstream in our context, that person might suffer or might experience greater challenges in their process of getting services, finding community, developing a healthy identity. So we should be putting more emphasis into those communities. There is a concept that I heard from my supervisor at the LGBT Center that I think is pretty powerful, and when talking about these communities, stating that there is not a vulnerable transgender community. It's a community that has been vulnerable, that has been made vulnerable by society and by oppression and by the institutions and other community members. I think it's the same with poverty. We don't have poor people. We have people who have been impoverished. So if we have someone who is transgender, who belongs to a community that has been impoverished, therefore more of a need to also tackle these other concepts that I'm going to be talking later, which is economic justice. But before that, let me talk a little bit about the importance of a feminist approach. As I mentioned earlier, we live in a patriarchal society that gives privilege and to male identified people, and this is unearned privilege. Salaries, we know they're still higher for men than women, the type of jobs that we can access to many things. So we need to make sure that, or as much as possible, that our agencies are working constantly on this issue of gender equality. Otherwise, we're going to see these transferring into the transgender community as well, creating more problems with transgender women. Economic justice, as I mentioned, the capitalist system that we are part of has a lot of advantages, but also has some clear limitations. And we sometimes could say that we have a very predatory system, sometimes giving credit cards and getting people to spend and as much as possible, as early as possible, regardless of their ability to spend and what is priority, finding themselves further down into this problem of poverty, so impoverishing them. We see how in Las Americas, in the States, but also in Latin America, despite some economies doing really well at a national level, the number of people living under poverty is expanding, is growing, so the concentration of resources, more for a few and less for the general population. All this is part of this economic justice. So I think it's part of our responsibility also to think how we can be part of that change. And with all this, basically, we are being a revolutionary provider, one that is ready to question and ready to challenge and ready to change all these collective imaginaries that have been imposed or infused by society, but not only the imaginaries, but all these structures as well. So it's not just a framework or an approach. I think it's more an ideology. It's how I see the world, my world view. So there is a huge challenge, but one that is really powerful to embrace. Now, as providers, let's talk a little bit about some important aspects to take in consideration, and then we will talk about other more concrete ones. We should be critical and analytical in everything that we are doing. as the role that we play at the agency, our relationship with the client, our relationship or our stance regarding public policies that will impact these communities. Do we have neutral bathrooms or not in our building, regardless of being transgender community there already on a regular basis or not, meaning all these things that will impact everybody else. The provider needs to be willing to have continuous learning and one that is extensive. Why is that? One is we need to know about the history of these communities and the history of the community of the person in particular. We need to be aware of positive role models and role models that are diverse. So not only the ones that are appearing in the front of the magazine or in media, but also in every field, I will say, sports, science, education, politics, entertainment as well, etc. And diverse in all kind of shapes and forms, all in young and males and females, transgender identified leaders or role models, Asian background or African American or Latino heritage, etc. We need to be aware also of what is there that is being produced by the scientific world. So what are scientists finding out about these communities, better ways of serving them, what is going on with them, best practices and the evidence that is there for those, along with what is the knowledge that is created by communities. And I think both are important and they don't have to be exclusive of each other. Science sometimes is creating a lot of powerful knowledge, but sometimes is behind what the communities are already doing. Communities are doing powerful work that sometimes is not being documented, is not being published, is not being socialized as powerfully as the scientific knowledge. So that connection is important. And then legislation, because through legislation, public policies, etc., is how all these socialization is regulated on a local level, city, state level, national, and even globally. What are the protocols, for example, for accessing hormone replacement therapy nowadays in other countries, and what is that is being internationally enforced or promoted? We should have a role of activism. I don't think it's enough just to be a provider inside of a office interacting one-on-one with the transgender client or the group. We need to be out there because these communities experiencing a lot of problems caused by society. I think it's just fair to expect that we all, community at large, cisgender people, are part of this healing process. It would be completely unfair to expect the transgender people need to do all the work to change everything that society has created negatively for them. Advocacy is a very important role because a lot of times we're going to find tensions between the identity of the client, the narrative that the client has, the discrepancies between what the legal document or the driver license or the passport or the Medicaid card is saying regarding the name, gender, etc., and what the client is presenting as. So we need to be very careful of not becoming gatekeepers and imposing oppression or causing oppression, further oppression to the member, transgender person, or the community, but advocating on their behalf, helping the agency understand new ways of doing things, navigating and being creative and finding middle places or alternative places where we can meet the needs of the funder or the agency that is that we need to report to, but always taking the side or align with the person, with the transgender person or the transgender community. Therefore, we need to be constant agents of change. Always look for what is there to be done. How can we improve conditions for this community at every level, including basics like the forms, the questionnaires, the paperwork that clients need to fill out or that we do on their behalf. There is an example here with this little image. It's a little bit blurry, but we have the typical binary male, female marker, but then we have transgender female, transgender male, gender variant or gender non-conforming, not listed. And I want to highlight that. How powerful is to put there not listed versus other. If I put other and the client is reading that, by default, I'm telling them you don't belong to anything and you are in a place when anything that doesn't belong is being put. When I said not listed, the power of language is basically saying you belong to a community and you have others like you, and that's perfectly fine. It's just that in these questions, we didn't list your community. And it's kind of taking ownership of these oversight and giving a space for them to name it. So we can track down what is this community that we are not listing. Is it important for us to track it down? Sometimes clients might have their own take on why they don't want to answer one way or why they want to answer another way. Doing psychoeducation is very important, explaining to the client why is that we are asking and where is this information going to. This is empowering because the client sometimes can understand, okay, if I don't identify as transgender person, that might make me invisible and funding for transgender services might not be happening, or there might not be ways of tracking services that have been provided for the transgender. That doesn't mean that everywhere I go, I have to put the trans word in front of my gender identity. A lot of transgender people would prefer to identify as a woman or as a man without having to mention that they have a transgender experience. And giving them the option of not having to answer. That is also empowering, if that's possible. And what would be the impact for the agency, and to be willing to take that impact more than putting pressure on the client to minimize the impact for the agency. If we do all these things, then I think we can call ourselves real allies with the community, because we're doing the work with them, for them, that is transformative, not just tokenizing or putting a little sticker with the white, blue, and pink stripes as a transgender competent and just leaving it there with some basic knowledge of concepts. So as providers, and this is the last part, one of the most important, I would say, I think it's very important to be aware of our social location. And that means where are the places in which we hold power and privilege in relationship to this other one that we have in front of us, in this case, the transgender person. So, for example, if I'm the provider, I will identify as cisgender male. And that comes with a lot of power and privilege that I didn't earn. Society just gave it to me. And it is important for us to mention this and see what it means to the client, open those spaces in a safe way so the client can explore what it means to be getting services for a cisgender male. Would they prefer to have a cisgender female if possible? Is there any transgender person? That doesn't mean that everybody needs to be getting services, but by someone who identifies exactly as the client. Client provider identify exactly the same. But I think it's important when there are differences to name them and see what are the implications. If we don't name them, that doesn't mean that they don't exist. More often than not, the client will be aware of those, and that can lead to not compliance with treatment, early termination, disengagement, inconsistency, etc. So it's in our best interest, the agency and the client, to be aware of these and to name them. The other piece is internalized transphobia. As I said, we are all byproduct of our society, our times, our cultures, our religious or spiritual institutions. Therefore, it's very likely that we learn negative things about this community before we learn even positive ones. We might have a bias in that perception, and therefore we need to keep ourselves in check. Because if we're not aware of that internalized transphobia and we pretend that we are neutral or accepting, that there is nothing negative that might have impacted us growing up and therefore translating into our daily interactions with these clients, it's likely that it will come up unknowingly, unconsciously, and interfere with the provision of services. We talked a little bit about strength-based, so I'm going to skip that one. and just emphasize the use of language that will honor the person. We cannot have a language that would be good for the whole community. Some people might decide to identify as female to male or male to female. Another person might want to identify as trans woman, trans man. Another person might want to say, I'm a man of transgender experience. So we need to find those terminologies that are meaningful to the person that we are working with, understand their history and how they came to identify that way, and how culture was part of this history, both with the struggles and the positive things and the strengths, to create this unique identity. So we have to do this with every single person, ideally, if we can find the resources, the time, etc. And then explore the identity of the individual both historically and at present. So it's creating a timeline, a life timeline that will describe how was this identity developed. And again, important not to only emphasize on difficulties or traumatic experiences, but life in general, both the good times and the difficult times, and how all those inform the identity of the client. Other considerations, there is two terms that are frequently used in social work, psychology, psychoanalysis, which is transference and countertransference. I think it's important for all providers to be aware of these, regardless of your training. So I'm going to give a very simplistic definition that will help us understand, and then how that might play out in our work with transgender community. Transference and countertransference are unconscious thoughts and feelings that might come up. Transference refers to those from the provider towards the client, and countertransference is from the client towards the provider. Excuse me, the definition was switched. Transference is the client towards the provider, and countertransference is the provider towards the client. And basically is how unconsciously the other one is perceiving me, and I am unconsciously perceiving the other one. So a client who is sitting in front of me, who is transgender, because of my cisgender male identity, might perceive me as someone who has been cause of pain and oppression and discrimination. Let's say it's a transgender woman in a patriarchal society. That person might see me as part of the one that caused a lot of pain and discrimination based on gender for being female, and on top of that for being transgender female. That might not be conscious, but it would impact how we relate to each other. And countertransference would be, how do I perceive that other person unconsciously? Those thoughts and those feelings will inform our behaviors. That's why I think it's so important for us to make them conscious, be aware of those, so we can monitor the way in which we are acting, and hopefully do that more adequately. We talk about intersectionality, so we talk about race, class, immigration status, age, abilities or different abilities or disabilities. We talk about socioeconomic status, anything that we can consider, and see how all those are playing out, because it's not the same as I expressed earlier. Just focusing on one part of the identity or a couple of those, race and gender, ignoring the complexity of a person's identity, where more than just race and gender or religious affiliation, etc. So all the pieces of the identity that are important to the client, how those are interacting with each other, and how those inform who the client is and how they are perceived by the world, treated by the world, society at large, and how do they navigate, how they navigate the world. To have an affirmative approach based on a positive model of transgender identity development is very important. We don't have time here today to go into the specificities of a couple of models that are there, but I will advise you to look them up. There are few, but they're powerful when we can understand how people come to be and come to identify themselves as transgender, what are the implications from a positive model of this identity, how it comes to be. We talked already a little bit about terminology, so I'm going to move forward. Interdisciplinary, interinstitutional work is key. One is there is usually different needs, so it's good to have legal advice, it's good to have a medical provider, it's good to have a mental health provider. It might be good to have someone who is doing case management or concrete services because of the complexities of the challenges that this community may be facing. And a lot of times we don't have all these resources within the same agency. So it's very important to know where are the agencies that can give me knowledge and expertise in different areas. Where are the other professionals and the other agencies? So let's identify those. Let's have agreements for collaboration between the agencies and MOUs, memorandums of understanding as to how to work, how to refer a client, how to make sure that they are treated the best way possible when they have to access different services in different agencies, so we don't make it even more complex for them, but facilitate the process. And including among those, I put there spirituality as well, finding spiritual leaders from different religious institutions that can give a different analysis, one that is more positive about the transgender identity, and help people conciliate this part. Participatory community organizing, so nothing about the transgender community should be done without the community, so they should be involved at every step of the process, from advisory groups, our brainstorming of the services that need to be put in place, how to implement those services, how services are being provided, evaluating programs, looking for funding, creating reports, changing policies, organizing community itself, etc. So let's create spaces for the community in our agencies. And the last one is empowerment. So creating spaces for the community to take power and be part of that change that they need and want to see happening. I think this might be very important for some people, might not be for others, but it's important for the community at large to have that space when they can be part of the testimonies given to city council to change city policies, when they can be part of the board of directors at the agency and come and express their experience as transgender clients at your agency, when they can inform people who are in charge of designing the paperwork, the forms that they are filling, why it's important for them to feel welcome, to feel safe, what are the kind of questions, the language that they would like to see reflected there. So having community participating in their own transformation is very important. Finally, some resources. So we have first, Transgender Basics is a video that was generated by the Gender Identity Project. This is a program within the Lesbian, Gay, Bisexual, and Transgender Community Center in New York City. Very easy to understand, very simple. If you have questions about the terminology that I used here, want to see people talking about their experiences as transgender, male, female, genderqueer people, etc., great starter. Then there is a document that helps people keep the conversation. Sometimes we are very shy because we may not have a lot of experience, or we need to be talking about this and take the risk sometimes of making mistakes. That's part of the learning, but there are ways in which we can avoid those mistakes, and it would be even better. The third one is Trans-Latina Network. This is a network in New York City, and it's an organization that does powerful work supporting other transgender people, from paid internships to community events to community at large visibility, etc. Around medical care, Cal and Laura Health Community Center is a great institution. They provide hormone treatment for transgender youth and adults, and very competent staff. They are also now in Brooklyn and in Manhattan, in their first site. Urban Justice Center is an agency that advocates on behalf of legal rights for this community. So when they face discrimination, either by immigration or mistreatment or abuse, or by the landlord or by any institution, is a way of protecting their rights and giving them legal support. And then we have Immigration Equality, has a great program for asylees or refugees, asylum seekers who are transgender. Their website, by default, has a whole section for transgender people that gives a lot of good information. I always advise providers, if you're working with immigrant community, and that community might have members, transgender members that are coming to you, it's very important to be familiarized with this agency, their website, and all the info that is there, so we can also do psychoed to the clients. For members of the family, there is a peer support group that is well established in New York. It's PFLAG, Parents and Friends of Lesbian and Gay. Now this group is also a comprehensive one that provides support to bisexual and transgender community. There is even one chapter in New York City that emphasizes working with people of color, LGBT people of color and their families. So this is a peer support group for relative strengths. If we are talking about treatment, the Gender and Family Project at the Ackerman Institute for the Family has a great programming where the whole family can get services when there is a transgender child in the family. So the parents will be in support groups with other parents or in their couple therapy, while their siblings of the transgender identified child are having some play therapy and intervention, so they learn how to deal with the stressors that come with having a sibling that identify as transgender at school, in the neighborhood, play dates, sleepovers, all these dynamics. And at the same time, the transgender identified child is getting services. So this is mental health services all in one, with emphasis with services for families with youth, with children and youth who identify as transgender. And then the New York City Lesbian, Gay, Bisexual, and Transgender Community Center has a youth program that provides spaces for socialization for teenagers and young adults. They have a summer camp. They have all kind of activities that are not necessarily framed as psychotherapeutic, but can be very empowering, very affirming on their identity development. So please check those out. And I think that's all what we have here for today. This is the reference I used from SAMHSA, the Substance Abuse and Mental Health Service Administration, the publication I mentioned at the beginning with the statistics. That was in 2012. And we'll leave you here with questions, and we'll get back to you with answers. So thank you, everyone, for being with us today. And let me know if I can help you in any other way. It's been a pleasure. Bye.
Wonderful. Thank you, Andres, for your presentation, and thank you to all of those listening to the recording today. Like Andres mentioned, the presentation slides will be available on our website, ctacny.org, and please feel free to contact us with any questions. And I am going to show Andres' email address right here, as well as the ctac.info@nyu.edu email address to contact us. So thank you again, everybody, for joining us. Have a wonderful day.